Hi, I am Dr. Rajendra Patankar. I'm the Chief Executive Officer of Jupiter Hospital at Baner, Pune. So this COVID-19 pandemic has taught us a lot. It has taught us how to adapt ourselves to the changing times. From the perspective of hospitals and healthcare, a lot of changes have happened in the post-COVID times that we are facing now. While earlier times we never had any major infrastructural space as far as an isolation room or an isolation ICU in a hospital, now it has become the need of an hour. No longer can we have just one or two isolation rooms in a hospital, but we need to plan it while constructing a new hospital to have a clear isolation ICU, isolation wards, where the entire ventilation systems are differently designed based upon the requirement of the infectious disease. So infectious disease, which used to earlier contribute to just a minuscule percentage of infrastructural requirements, have now taken a certain substantial proportion. Just like clinical care is growing by leaps and bounds across the world, managing these setups or hospitals have also increased. Earlier, the courses in hospital administration or healthcare administration were hardly available in this country. But now more and more such opportunities are available for youngsters to get into the field of hospital management or hospital administration. I personally feel that there is a huge demand-supply gap in this country for professional hospital administrators who understand the system from inside and who are then involved in managing the place. For young hospital administrators, I would recommend that they need to spend more of their time on the ground. When I say on the ground, it means on the patient bedside, in the operating theatre, in the finance department, in the HR or marketing, more in these areas across the hospital spectrum to improve their skill sets as a good hospital administrator. What I find lacking in the current generation is they find more time reading notes and books rather than being on the field. So my advice to the youngsters is to be a practical oriented hospital administrator. So hospitals are a very complex kind of organizations. They are labor intensive, so to say. You have the most superior super specialist handling the most complex of the technologies to the basic simple housekeeping staff with the hospital. Both importance is very well documented and appreciated by patients. Similarly, hospitals are technologically intensive, right from the very basic simple equipment to the most complex robotic joint replacement machine or a neurosurgery neuronavigation system or a cath lab or a linear accelerator. You have the entire spectrum in a hospital setting. You have the most simplest to the most complex engineering services available in the hospital. My take on this with the hospital administrators is that they need to be good and knowledgeable in all these fields, not only a specific area in hospital administration. This is something which will take them ahead. This is where I feel that there is a huge gap between what students who pass out hospital administration come out with, because they lack a very clear practical approach. That's where I thought I should write a book, and I'm glad to share that I'm writing a book called The Practical Administrator for students for the new generation. If you look in the past, to get a doctor's appointment, to book an ambulance, to get to the hospital was difficult. If you make a phone call to the hospital, nobody picked up your call. If you had to ask questions to your doctor, there was a huge waiting time. Now, post-COVID, things have changed. Hospitals and patients' expectations have completely, radically changed. This is where we need to understand that patients' feedback is the one which will single-handedly take the healthcare and the hospital to the next level. Patient experience has become paramount. Like I always said, it is very important to take care of the patient, who is the main central entity around which everything in a hospital or a healthcare setting revolves. Typically in Jupiter Hospital, the term patient experience or a customer experience is where individual experiences which the patient gets when he comes in contact with the hospital, what we call as a patient touch points or a customer touch points. Earlier, nobody really bothered about managing them, about understanding and acknowledging the expectations of these patients who wish to come to the hospital for their healthcare requirements. Post-COVID, or even prior to that as well, Hospitals have started to recognize the importance of this patient experience. Right from the time when the patient decides to come to a hospital and makes a phone call to the hospital, to the time when he enters the outpatient department or he enters the emergency department, the way he is handled, the way people are approaching him, the way information is being shared with the patient, all these things right up till the time the patient gets and meets the consultant or the operating team, and in the process of the whole treatment and discharge. Nowadays, patients are preferring to go to hospitals where the experience is good, not where only good treatment is given. Earlier times, doctors were never asked by patients, they were never questioned by patients. Whatever the doctor said was right. That while that still may be true, as far as the clinical management of the patient is concerned, patient also wants to be a part of the whole process. Patients want to be understanding the whole concept of how the consultant is going to take care of his clinical condition, and he wants to participate in this whole improvement of his physical condition. I think a substantial change has happened in this current times, where more and more engagement is happening between the professional, not only the doctor but also the paramedical, the nurse, the administration, along with the patient. Right from the time when the patient calls the hospital, hospitals are more now aware of ensuring that the patient's phone call is picked up in the third ring, like we follow in the hotel industry or a service industry, to welcoming the patient in the outpatient department or for a health checkup, and ensuring that there is a clear line of communication between the patient's movement from entering the hospital to his exit. Jupiter Hospital was inaugurated in the year 2009 at Thane. That was the first hospital which was inaugurated by one of the senior most members in the city of Thane. He was a citizen of Thane. That is where Dr. Ajay Thakkar, our chairman of Jupiter Hospital, said that the philosophy or the cornerstone of our functioning will be the patient. That's why our tagline says, patient first. This patient for us is the planet around which all of us revolve, whether it is the doctor or the nurse or the paramedical staff or the administrator. The main entity for us and for our existence is this patient. It's been almost 1.5 decades or 15 years that we are celebrating the 15th year of our existence. Post Jupiter Hospital at Thane, we have 2 more hospitals, Jupiter Hospital at Pune and another Vishesh Jupiter Hospital at Indore, which are in place. From a mere 50 doctor to 400 staff setup, we are almost 5,000 strong team amongst and handling almost 1,100 hospital beds in the tertiary and the quaternary space. We have almost everything under the one roof, right from the basic medical to super specialty services, including the robotic transplant, including neuronavigation, the best state-of-the-art onco care is available with us. We do one of the largest numbers of transplant and solid organ transplants and bone marrow transplant surgeries in central and in western India. Jupiter Hospital has certainly plans for expanding in the healthcare space beyond our existing 3 geographies. I am glad to share that we are coming up with a tertiary care hospital at Dombivli in the suburbs of Thane or Mumbai, so to say. And going ahead, we would maybe add a few more tertiary care setups in the western region.